Test, 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 test.
What are these? Yeah. Microphone.
Test, test.
Same as.
I think test, test, test. Test, test.
Hi, everyone. It's Dr. Latowski. Thank you so much for joining us today for our November webinar. Listen, we are being proactive this month. We are getting ahead of the season and we're thinking about our bodies and what we want to do to be ready for spring and next summer. And also, incidentally, all the holiday parties coming up. So I thought we would talk about Body by Clear today. Body by Clear is a division in Clear Dermatology where our expert team of body specialists are going to treat you. And we're really going to focus on these specialists only treating body off the face. And so it really will help us to achieve true expertise in this area. I got involved in a lot of body treatments about 8 to 10 years, probably 8 years ago. There are some research projects we started doing with cellulite, specifically Resonic, and then something called Quo. And it really got me into the body treatments. And I started doing a lot of treatments for cellulite, but also for lifting, fat treatment, etc. And that has just grown over the years, so much so that I really wanted to add a whole department focused on body treatments. Also today, we're going to be introducing Kara, who's our newest Body by Clear member. And so she is our expert in cool sculpting. So she will actually be cool sculpting me today. And it's been a few years since I've been cool sculpted. And if you haven't seen cool sculpting, this is your opportunity to do that. So we can basically treat anywhere off the face. We have these technologies. We actually have a few others that aren't listed here, but these technologies help in different ways to treat the body. So we can treat fat, we can tighten muscles, we can tighten the skin off the face on the body, we can improve collagen, we can kind of shrink wrap areas on the body. So we're going to start with cool sculpting. Cool sculpting is a technology that has been around for just under 20 years. When I was a fellow in 2008 to 2009, we actually did the FDA approval trial for cool sculpting. And I thought to myself, there's no way this technology is going to work. It's too good to be true. At the time, there was no way to non-invasively treat fat. Liposuction and surgical removal were really the only options available. And cool sculpting ended up, as you could probably guess, being extremely effective and safe for the treatment of fat. And it's completely non-invasive. So really, really cool breakthrough in cosmetic dermatology at the time. So I continue to use cool sculpting since the very beginning. So now it's been FDA approved for 15 or so years. And I'm a huge fan. I've had the treatment done myself, as I mentioned, and I've done the treatment to my family members, including my husband, several times. And I feel very comfortable with the safety. I have been a part of clinical trials even since FDA approval with new indications with this technology. We own the newest cool sculpting device, and I also serve as a consultant to the company that owns cool sculpting, which is Allergan AbbVie. And I help people across the country who are providing cool sculpting services and have had issues with the device, and I help get them through these minor issues that they're having. So this newest device is called Cool Sculpting Elite. It is, again, completely non-invasive, and it's the newest sort of model of the device. So it differs from other models in that the amount of suctioning is not as is gentler on the body, and the device is able to cool the fat more efficiently and spare the top part of the skin, the epidermis and the dermis, even more safely than before. And so we see a lot less side effects than we used to see. And even when we had the older devices, really side effects are quite rare. So this device is FDA cleared to treat fat in 9 different areas. And it literally works by freezing the fat called cryolipolysis. So the fat cells become little icicles. And as they thaw out, the icicles cause the body to actually get rid of the fat cell, just like in liposuction. There are a lot of technologies out there that actually just shrink the fat cell, but the fat cell is still there and able to come back. But this is a technology that actually gets rid of the fat cell, so the fat cell does not come back. And that's what makes it so amazing and permanent. So, like I mentioned, Kara is our body contouring specialist. We also have our estheticians performing cool sculpting, and Maya and I, our nurse Maya and I would be happy to talk to you about cool sculpting. It's a really amazing technology, and we can kind of talk you through it. But most of the time, patients come in and consult with either Kara, the specialist, or one of our estheticians, because then they're able to get a really accurate idea of pricing. And one of the beautiful things that we love, especially this time of year when there's so much going on socially, is that there's absolutely no downtime. You can go work out, you can go to a party, etc. So it doesn't slow you down at all. And it's just really an awesome treatment. Here are the areas that are FDA approved. Basically, the device works with a suction. It's like a big suction cup. So it suctions the fat into the suction cup, and then it starts cooling. And the cooling, as I mentioned, gets rid of the fat. So anything that you can suction, you can treat. So it's really cool that we can do all these areas. Um, Cool sculpting is completely safe, and it's been tested and used extensively. So we're quite comfortable with the safety. It's very effective. Most patients will want 1 to 4 treatments, just depending on what their goals are. Um, for instance, we have a patient here who had a great result in this the area I'm going to have treated today, this little bat wing area. And she actually was not initially super pleased with her results until kind of later when she realized that her arm was actually much smaller. So everybody has a different goal. And, if you would just be happy with a little bit of improvement, then you're going to do 1 treatment. If you really want to go for the gold, then you're going to do 4 treatments or so. And so with this new device, we see the results earlier than the older devices. So you can start seeing results in 4 weeks. And the results are really noticeable in 2 to 3 months. And even after about 6 months, that's kind of where you see your final results. And we talked about them being permanently removed. So this is a technology that's really good for a quote problem area. So if you have a little area of belly fat that has popped up after having a baby, or as your estrogen is going down in women, that's a common area that we will treat in this age group. A lot of times for men, we treat their flanks or their love handle areas. This tricep area is a really commonly treated area. And I always think about it as being a 20 to 25% improvement. So if you pinch the fat and you imagine 20 to 25% going away, that's the result from your first treatment. And then each treatment, whatever is left, it will be 20 to 25% of that area. So it's really effective. Here is a result we had with inner thighs. You can see that's a significant difference in the size and shape of her inner thighs. Here is outer thighs. You can see the outer thighs, you no longer have that bulge that you have in the, what do you call that area? The saddlebags, in the saddlebag area. And here's a bra fat example. And this also is a common area that we treat and very high satisfaction rate. So tummy area, you can see much better in the after picture. And this is love handle area, just much tighter. Waist is more defined here. Abdomen, you can see her great abs in the after picture. It's really, really effective. So before and after in the abdomen. And here is an example of double chin before and after, or submental, they call this submental fat before and after. It's a really great result. And you see, when you get rid of the fat, initially we were worried that people would have a lot of saggy skin, but the skin actually kind of contracts after the fat is gone. So in cases like this patient, she looks way better after she's had this area treated, and she doesn't have a lot of hangy skin in that area. So same area here. You can see it just makes a huge difference in how someone looks. And it's pretty cool because, again, this is completely non-invasive and safe. And so I am so excited to be getting a treatment today. And it's just a big pick me up to be able to do something for yourself like this. So moving on, let's go to muscle tightening. There's a lot of people who are losing weight right now, and it can be due to the GLP-1 agonists, or it could just be that a lot of people are emphasizing diet and exercise right now. Whatever the reason for the weight loss, it's great. But a lot of times we see muscle as part of that weight loss. Almost all the time we see muscle as part of that weight loss, which is why patients losing weight are really encouraged to increase their protein intake to try to and do weight exercises, try to counteract the weight loss from the muscle. Also, something like a cool tone treatment will help to counteract this muscle loss. So, cool tone uses magnetic energy to contract the muscles. And of course, it can do this much more efficiently than we can do on our own. So, and then by contracting the muscles, we also get a little bit of fat loss in that area too. So you can use this for definition, and you can use this for prevention. I really love this technology for functional use. So when we treat the core muscles, the glutes and the abdomen, we see a huge difference in someone's posture. So there are so many ways you can utilize this. So people who have back issues, we see a huge improvement in the discomfort and the pain. People who have posture issues, people who maybe get back issues when they're playing golf or tennis, this can really, really reduce chance of pain and injury in those areas. Like I mentioned, really, really important to do something to build the muscle back up when someone's losing weight. So this is something that will help to supplement weight workouts when someone's on a weight loss program. And then finally, if someone does have an injury and they can't, for instance, if they have a knee injury, they can't use their knees, they have to give it some rest, we can actually target the glutes or the quads and contract those muscles and prevent some muscle breakdown while their joint is healing. And that's been a really useful application of this technology as well. Super easy, non-painful, non-invasive. It's just this little applicator and goes right over the muscle. You're fully clothed and kind of strap it on, and it contracts your muscle. Kind of a weird feeling, but this device for me got me through COVID. We didn't really have many people in the office, so I would hold my meetings in the cool tone room, and I would just be sitting there working my abs while I came in, while people came in and had meetings with me. And you really do get kind of that runner's high afterwards too. So it was a way for me to control stress during COVID. I guess we can put that as another application, but no downtime here. And you're not really sore either because the contractions of the device will actually work out the lactic acid at the same time. If you have the treatment done, you'll notice there's different patterns of contractions. And so some of the contractions are specifically designed to get rid of the lactic acid to eliminate soreness. So that's pretty cool. So with the glutes, you get elevation and definition. If we're talking about aesthetics. For the abs, of course, definition for sure. And then, of course, you get the benefit of having a tighter core and a stronger core. Definition here. After abdomen use, definition, after abdomen use, look how much less bloated this patient looks too. Another example of abdomen use. And again, so really, really great and safe treatment. Going on to another fat treatment. This is Kybella. So this is another option that we have. This is an injectable detergent, actually. So it's an injectable FDA-approved detergent that's injected, and it will basically dissolve the fat cells. So again, this is a way to permanently remove fat cells. We commonly use it in the chin area, so the submental area, they call it. So they break down the fat cells. You do experience some swelling. So there is a little bit more downtime with this one than there is with CoolSculpting. And you see the results after 6 weeks. If we do another treatment, it's usually after 6 weeks. The reason I love this treatment is that it's very predictable and it's so quick and easy. This is like you come in during your lunch break type thing, or if you need to be in and out of the office very quickly, or if you're just not patient. I didn't mention earlier, but the CoolSculpting takes 30 minutes once the applicators are set up, and you'll see later it takes a little bit of time and love to set the applicators up. Especially on a thin person. So you're usually in the office about an hour for CoolSculpting versus, you could literally be in and out in 10 minutes with this procedure. But it does have the swelling. So that's the trade-off. So there's bruising, potentially swelling for sure, maybe redness, a little bit of tenderness, but you can reduce regular activities after 24 hours. And again, it's FDA approved for this area underneath the chin, but you can really treat it in kind of the same areas we saw with the CoolSculpting. It's just, you don't want to treat a big area because it's kind of cost prohibitive to treat a big area. But if you think of the area of the double chin, that's the kind of size we usually treat. Cost is about the same as CoolSculpting. And here you see someone, I did this actually a webinar patient. I treated her bra fat, and this is just after one treatment. So it's super easy, super quick. Different patient, I treated bra fat. I think that was one treatment, 1 or 2 treatments. So just really quick and easy, safe, predictable. It's great treatment. So we have options for that. Now moving on to a fourth technology, Agnes RF. RF stands for radio frequency. So this is a different type of energy source. This is an energy source that's going into the skin and heating the skin, and therefore we get some skin tightening. Now, I talked about loose skin earlier with CoolSculpting. The skin will sort of like move with the body as the fat goes away. But here we're talking about actual independent tightening. So if someone wants a little bit of fat to go away and a lot of tightening, this is our treatment. So for this technology, we tend to do the lower face, including the jowls. We can get rid of a little bit of the jowls and then tighten the lower face. We do the double chin. We can tighten the neck, and then we do the fat around the knees. And I think that's one of the areas that really specializes in fat around the knees. So here's a little cartoon. The needles go into the skin. So first we numb with injectable lidocaine. And then we put these needles into the skin. You don't feel it because, you are numb, and then you release the energy, and then the energy goes in, and depending on the settings, so I am deciding if we're going to melt fat or if we're going to tighten skin, and we do usually do both during the treatment. 1 to 3 treatments. Very, very easy as a patient. Sometimes there's bruising. It's usually not terrible. You do get some swelling off the face. It's a non-issue. And you see improvement within 2 weeks, but you can see most improvement by 3 months. You even see improvement after the 3-month period up to a year. This is very precise and safe treatment. So they use this needle that's partially insulated. So the insulation prevents or protects the skin. And then the non-insulated part provides this very precise heating of the skin. And that's why it is so effective and safe. So a lot of skin tightening in this area of the neck. And then here we defined the jawline and also just melted a little bit of fat around the jawline just so we got that definition. This patient, and this is actually not our patient. This patient, or not we, the company's, this is the company's photo, but they reduced the fat and then they did some skin tightening around the jawline. And then same thing with this patient, jawline, reducing fat and skin tightening. And this is not our picture either. I apologize for that. So really, really awesome technology for precise melting of fat and skin tightening at the same time. Again, the area around the knees is a huge, huge application for the Agnes device. Finally, SoftWave. And many of you have heard me talk about SoftWave. We've had other webinars on SoftWave. SoftWave last year was FDA approved for the body. And the study they did for this FDA approval was actually around the upper arm. So they treated this strip around the upper arm. And when companies do a study, they're usually trying to get a result with the least amount of work possible, because the more work that a site does, the more expensive the study is. So they actually did the study with a strip around the arm, and it was so effective. You could see where the treatment was done versus where it wasn't done. So they had to go back and treat the patients in the study because there was like this line of demarcation. And to me, that's just like speaks to how effective it is. So this device, again, it's completely non-invasive. I mean, this is just amazing. We have all these options that are minimally invasive or just non-invasive, like nothing is going into the skin. There's no needles. It's very, very easy and safe. So you can do this on your arms. We love doing this on the arms. We love doing it on the belly and on the knees. So I have had Agnes around my knees. I've had CoolSculpting around my knees. And I've also had SoftWave around my knees. That's kind of embarrassing, but the knees obviously are my problem area. Again, this is ultrasound and absolutely safe. No downtime or restrictions here. That's one of the benefits. Great around the holiday season. And you can see that this area in this patient, her chin is much tighter. You can see in this patient, again, jawline is more defined, cheeks are higher, neck is tighter. And same thing in this patient. Finally, we can inject things to tighten the skin. So it's really interesting. There was a study done that showed patients who came in once a year and had this injectable called Sculptra, where it looks like I'm injecting a filler, but it's actually something that stimulates your collagen. So it's injected, stimulates your collagen. Patients who came in and did that once a year, they actually had a smaller diameter of their arm. And so this injecting something that stimulates your collagen will kind of shrink wrap your skin as it ages. It will keep everything tight and compact. And so it's really a game changer to use these things strategically in areas that you want improvement. And I say strategically because we are not injecting for volume. We don't obviously want to give you volume in areas like your abdomen, your thighs, your arms, but we're doing it for skin tightening and contraction. And also, we want to do the areas that we get the most bang for the buck. So treating the face is expensive enough, but treating off the face, it's a bigger surface area. So sometimes the cost does become sort of our rate limiting step. So Sculptra is what I was just mentioning. It's FDA approved for a long time, over 20 years. And it's polylactic acid injected. It stimulates collagen. Super awesome product. Probably my favorite injectable to use as an injector because it just does so much for us. So you can use this, of course, on the face, but I often use it on the buttocks. I use it on the thighs, and I use it all over the thighs. And mostly I use it all over the thighs to tighten the knees. But even when people get older, they don't like the way their thighs look when they're walking. They feel like it's too jiggly. And so the Sculptra can actually help to, again, kind of contract everything to make the skin firmer so you don't have that sort of jello look when you're walking. Underarm skin, buttocks. I do a lot on the décolleté, especially for my side sleepers. They are self-conscious about the wrinkles here between their breasts. And so this can really help to fix and slow down that area, the aging in that area. So here we have a butt lift, and you can see the butt has come up and is perkier and rounder, has a better shape. Radiesse is a filler that, let's see if we have, Radiesse is a filler that also stimulates collagen, but it has a filler component. So it's really nice because you see some results right away. And then you also see some collagen stimulation. Whereas with Sculptra, you usually have to wait 3 or 4 months to see significant results. And again, this is kind of why we're doing this webinar now, so we can help you get ready for spring and next summer. But a lot of times we can see some results before then. Okay, so Radiesse, you see results right away, and you also see collagen stimulation. So we get tightening, we get lifting, we get smoothing. I often use this for cellulite dimples, so we smooth out certain areas. I do a lot of using Radiesse and Sculptra in the same treatment. So Sculptra will last longer than Radiesse. Radiesse will be obvious sooner and provides a little bit more lifting than the Sculptra. So they're really fun to use together, and you can use them in a certain way to really maximize the strengths of each one. So here I am injecting some Radiesse in the décolleté, really beautiful in that area. It improves the skin radiance as well as the lines. So we really, when we inject, we cover the whole surface area, and then I'll go back and spot treat the lines themselves. Here's an example of the neck. Notice not only the tightening, and when we treat the neck, we notice tightening by the neck looking kind of slimmer in the after picture. So you see that, but look at the skin texture change. I know there's a lighting difference, but you can really see the skin is just glowing afterwards, and that's because of the collagen stimulation. Here I am getting of course, my knees injected, the area above my knees. So, my favorite area to have treated on myself. So I know this is a lot, but the main purpose of me sort of running through these treatments is to let you know that we have multiple things, and we will customize these treatments for you. We'll customize them for your particular body area you want treated. We will customize them for your goals. We'll customize them for your budget and your downtime. So we have lots of options for you, lots of great options, and we are so excited to talk to you about them. And then we'll let you know what expectations to have as well. We want you to have realistic expectations so you're not disappointed with your results and you know exactly what to expect. Okay, the moment we've all been waiting for. Here are your promos. So I was thinking about the promos last night and I was really trying to think, because this is such a broad topic, I was really trying to think what would appeal to the majority of people. What would be like a safe bet if you weren't quite sure what you needed? And here is what we came up with. Okay, this is what I'm treating today, the one on the left. Wave hello to toned arms. How many people feel uncomfortable waving because they have some floppy skin here? That is me. So I'm having cool sculpting done. But this package is 2 vials of Sculptra. So 1 for each arm. This is going to get rid of the jiggling, the jello, and this is also going to just help the skin sort of contract because it's tighter. Also, soft wave to the upper arms, not like in the study where there's a line of demarcation, but tightening of that loose skin, especially a lot of men notice around the elbow, they get a lot of loose skin there or sort of flanking the bicep muscle. And so these treatments will help you to feel more confident and to, especially if you do a lot of weight training, you do all this weight training, you're used to having really tight, smooth arms, but over time, sometimes the skin gets a little wrinkly in that area. So this will help with that issue. So you save $1,000 with that package. Moving on to my favorite area to get treated on myself, the knees. So many people come in. This is my number one complaint. And people who come in, not my complaint, but what people bring to my attention, who come in and if they're not asking about their face, a lot of times they're asking about the area around their knees because it gets kind of crinkly over time. And a lot of us have extra fat in that area. So I can treat the fat with the Agnes. I can tighten the skin with the Agnes, and I can also inject Sculptra around that area. And so this package includes 1 Agnes treatment and 2 vials of Sculptra. You save $1,000. And then finally, your abdomen. So we're going back to the cool sculpting and the cool tone. We're going to get rid of the fat. We're going to tone the muscles. We're going to make your waistline more defined and kind of like it used to be. So you get 4 cool sculpting visits, which is the fat treatment. You get 3 cool tone treatments. You save $1,000 with that treatment. You have until Monday to decide if you want to take advantage of this package, any of these packages. Please feel free to call the number on the bottom of the screen, email us. If you have questions, text or email or call that number. And please, please, please let us know either today or Monday, end of day. But at the end of day, Monday, we're cutting off the promos. I would love to see you guys take advantage of these promos and do something for yourself this holiday season. And again, all these things are really easy. There's almost no downtime to these treatments. And in the case of the cool sculpting, there's 0 downtime, 0 restrictions, great things to do around the holidays. And you'll be so glad you did them by the time short weather comes back in the spring and summer. Here's the raffle that everyone who's attending is eligible for. Thank you so much for giving us your time on a Friday afternoon. Really, really appreciate you for tuning in. We're going to pause now. You don't have to stay if you don't want to, but if you'd like, you can see the cool sculpting applicators applied to my arms, and we'll start the cool sculpting treatment. So I'll stop right now, and thanks everybody again.
Hi, everyone. Sorry about the delay. We are going to cool sculpt Dr. Latowski's arm today. I know that's a little chilly.
It feels good though.
Well, good. I hope it continues to feel good for you. And once it's all connected, I'll have things to support your arm. So we just tell the machine where we're treating, all of that. It's all set up and ready to go. Okay, now the vacuum has started. So I'm gonna have you put your arm out, like level with the floor. Perfect. Don't worry, I got the gel pad.
Okay.
Okay. We are suctioning. There it is. It's nice and tight. So then the cooling will begin. We'll get you strapped in and like supported.
That's all there is to it.
Easy.
Easy peasy.